Okay, we don't have to worry about it this morning, but hey, just wait till this afternoon and tomorrow. The streets are going to be icy and slippery. How we can all stay on our feet and avoid a nasty fall. Some important tips to go over for winter travel. We'll be right back. Welcome back. We're expecting another big snowfall this week, and no matter how long you live in Chicago, you just never get used to it, do you? So it's not a bad idea to review how we can deal with it best. And we are joined by Dr. Jourdan Cancienne with Midwestern Orthopedics at Rush University Medicine. Good morning to you. Nice to see you.
Likewise. Thank you for having me on.
Okay, so here you are, this orthopedic guy. Every time winter comes around, you're thinking, okay, I have a feeling we're going to be seeing some people in our office. What would you say are some of the most common accidents or things that you have to deal with as a result of people trying to deal with this bad weather?
Sure. I think the most common things we see are falls. And I think when you look at the mechanism of the fall, it's obviously a slip and fall. And the way we try and protect ourselves when we fall are to inherently put the hands and wrists out to break your fall. And unfortunately, that can result in some wrist and upper extremity injuries. And then if you fall on your bottom or on your side, you're typically dealing with some hip contusions or injuries.
Okay, so what's the best way to fall then? What do we do? Okay, I'm walking on the ice and I'm about to slip. Okay, and this may make a difference. Backward or forward, how do I handle that fall?
I think both ways are acceptable. I think the important thing is first when you're walking to have your hands out of your pockets so you can appropriately prepare for your fall. And I typically tell patients and people to try and fall on your forearms instead of your outstretched wrist. Those are more durable bones, more built for falls. And then if you're going to fall backwards, which is also fine, I would try and fall on your bottom rather than on the side or the hips, because then you can involve the elbow or the hips more.
Okay, I got the bottom. When you say forearms, so I'm walking and I want to go like this as opposed to putting my hands out?
That's correct. I would come out like this instead of
Let's see.
Like this.
Do that again because we had you covered for a second. Show us again.
Oh, I would come out like this and try and fall parallel to the ground like this rather than put your wrist out, because then you're going to have this impact, and that is a setup for wrist fractures and other wrist injuries.
Okay, here's another common problem, and that is shoveling the snow. We've been told a million times how to do it, but it's not bad to go over that again. So what do you recommend when it comes to that?
Absolutely. So I would say bend at your knees and use your knees and legs more than you use your back. And then another tip is to keep that shovel closer to your body than far away. When you get it out in front of you or really far away from your torso, you're setting yourself up for muscle strains and other shoulder injuries.
Okay, so let's say you've done all the things you're supposed to do, but sometimes things happen, right? Accidents happen. At what point do you need to see a doctor, orthopedic person such as yourself?
Sure, I think no injury is too small. And in fact, it's not uncommon to have certain fractures or other breaks that you still have pretty good mobility in that joint, but it's very painful. So I would encourage anyone with a fall or any concern just to come by any of our clinics in the Chicagoland area at Midwest Orthopedics at Rush, and we'd be happy to see you, take some x-rays, evaluate you, and make sure that nothing serious, nothing that's going to get worse by continuing to neglect it.
So what's a typical remedy for a fall, would you say? What can people expect? Obviously, everybody's fall is different, but, what's a typical remedy for this? Is this something that you guys wrap? Is it something that you put a cast in? Is it something I'm going to get a shot with? What do you do?
I think it's somewhat dependent on the joint or the area of the injury, but typically it's going to involve some sort of rest, ice, compression, and anti-inflammatory, and depending on the severity of the injury, some physical therapy, and perhaps if there's a concern for structural issues, we might consider more imaging, such as an MRI and certainly x-rays.
Okay, what about those heating pads that we get at Walgreens or the cold packs? How good are those, and is that something we should maybe think about doing before we have to come see you?
Yeah, I think that's an excellent adjunctive therapy. I think heating pads typically loosen up the muscles and calm down some of the muscle spasms. Then the ice is very good to control inflammation. I typically tell patients to alternate. No one is better than the other. Whatever one's really working for the injury, I would continue to use.
Yeah, because that's the question everybody always has. Should it be hot or should it be cold? Okay,
Right.
Dr. Jourdan Cancienne with Midwest Orthopedics at Rush University Medicine. Thanks for joining us this morning. Hopefully you won't have any falls at all or any accidents, because people heard you this morning and now we know how to fall properly. Thanks for joining me. Good to see you. You take care.
Thank you.
Okay.
You too.
Let's head over to Caitlin now. Did you hear that, Caitlin? So fall forward with your forearms. When you fall back, your high knee's the best thing.
Oh my goodness.
Yes.
Yesterday I was in the backyard with my daughter, with Birdie, and it's just ice in our backyard. And I just took little tiny steps,
scary,
and she wanted me to hold her. I was like, if I hold you and I fall, that would be worse.
I know. That ice is dangerous.
Yes.